Moon nods, and let's head into the K-Wave News Zoom room where we have the Director of Public Health and Social Services, Mr. Art San Agustin, and he's joined by Annette Aguon, who's the Communicable Disease Immunization Chief. Good morning.
Good morning, Chris. Good morning, Sabrina.
Art, thanks for joining us. We're very honored to have you here on the link.
Chris, thank you for having me this morning.
Sorry it's so early. So there's been a lot of things going on with the vaccine, right? And we wanted to get you guys on as there was
the inaugural meeting yesterday of the Vaccine and Antiviral Prioritization Policy Committee. Is there a shorter way of saying that?
We'll just call it the committee.
Yes. The VAPC?
Yes. Yes, actually, Sabrina, that is something we were, as an afterthought, we're like, you know what, we're just going to call it the Vaccine Committee right now because this is only really one standing committee, so we just call it the Vaccine Committee. You're right. Lesson learned, we're going to look at shorter, quicker names for references in the future when we do the updated version of any public health emergency planning, because it has to roll out your tongue. Vaccine and Antiviral Prioritization Policy Committee. Yep. So it's definitely But the committee, like you did say, Sabrina, did meet. Inaugural meeting was yesterday afternoon at 2:00 via Zoom.
And you guys are scheduled to meet again today? I want to say.
No, it was yesterday.
During today's meeting, the VAPC agreed to schedule its next meeting within 24 hours.
Preferably at 5:30.
Right.
Upon us receiving our CDC guidelines, we don't have the. As we all know, has not been FDA approved or EUA approved just yet.
Okay.
And so those processes have been done, and CDC has done their part. And then we get the guidelines. We've agreed to meet shortly thereafter, but no more than 24 hours, preferably at 5:30 p.m. We were really just trying to accommodate all the different practitioners and all the members of the committee, the vaccine committee.
It's a pretty wide array of doctors and other health professionals, right? It's got to be tough to get them all at the same table at the same time.
Right, you are correct, Chris. There are right now, I believe, 23 members that make up this committee in varying disciplines, but primarily are of course, from the health care components. So yes, you're right, Chris. It is a large number of individuals, quite diverse.
Can we just then go through what was discussed yesterday?
Sure, I'll have Annette do part of that, but I basically, we all, of course, like anything else, it was our first meeting, and we basically just gave them an orientation of what the expectations and responsibilities are that would be laid out for the committee, that we are going to be guided by CDC, and the function and purpose would be that if there are any perhaps categories or groups of individuals that we'd like to consider that differ from the CDC recommendation, that this committee could make that recommendation. But in making that recommendation, we need to be sure that we are able to justify the change from the CDC guidelines, that information is shared with the public, and that we're transparent in the process. So we got to be sure that there's full access to all those eventually when we go to the general population. And basically what the committee does is it's monitoring the CDC guidelines and tracking to ensure that we don't make decisions that are for a special interest group. When I say special interest group, I'm talking one that was not perhaps in line with the order of vaccines to be administered. And Annette also went greater lengths of doing a PowerPoint presentation. And so, Annette, perhaps you can touch on some of the highlights of your presentation.
Thank you, Director. Yes, we basically gave an overview to the committee members. Majority of them are new. We formed this same committee back in 2009 for the H1N1 pandemic. And so we wanted to give them the roles and responsibility. What are the functions for this committee? What is our plan moving forward? We gave them information in regards to the Advisory Committee on Immunization Practices ethical principles, which we will also adhere to, just to be sure that it's fair, justly distributed out to everyone. And then we discussed the different phases. And we pretty much mentioned, again, we are looking at very limited doses as it comes out. And so how can we basically get the most benefit with these limited doses, as it will take several months for us to get more doses. I mean, there's announcements from the federal government that we're looking until maybe summer that we will have enough of our residents immunized. So again, we're still going to have to balance out, the 3 Ws while we're slowly rolling out the vaccination
Right.
to our high-risk targeted population, be it from your job, your duties, to the most vulnerable because of their age or their medical condition.
Right.
Can we then go through, because when we had you on, Annette, you kind of mentioned the different priority groups for the distribution of the vaccine and the different phases. Can we go through that now?
Sure. So currently, and again, this is the most important thing to note, is that this is all subject to change. Anything can happen after we talk about it today, or something tomorrow, based on what the FDA approves and what CDC and the Advisory Committee on Immunization Practices recommend, right? But currently, as it stands, our guidance is there will be 3 phases for vaccines. First phase 1, is very limited doses are going to come out. Phase 2 is there'll be a little bit more vaccines available, and then phase 3 there'll be they anticipate sufficient supply for our nation. So to further refine phase 1, because of the very limited doses that are expected, they broke it down to phase 1A, 1B, and 1C. Phase 1A, again, is for those healthcare personnel, and this was something that the Advisory Committee on Immunization Practices came out about a week and a half ago to further refine this group and saying, for phase 1A, it's healthcare personnel who have either direct or indirect exposure to people with COVID or infectious materials. So these individuals who are the front line are at highest risk of getting the COVID disease. Then they've added on the residents of long-term care facility. So that would include like St. Dominic's residents, and then individuals, who need assistance. So skilled nursing unit. And so those are the top group to get the very first shipment of the vaccine. And again, we've announced, director has said, right now for Guam, the vaccine A, which is the Pfizer vaccine, the ultra cold vaccine, we've been informed our total amount is 11,700 doses. But then you have to divide that by 2, because 2 doses, 21 days apart. So you're looking at only 5,850 people receiving Pfizer vaccine. So we have to allocate it to phase 1A. We offered that out, and then we move on to phase 1B. If there's any vaccines left, phase 1B is other essential critical workforce, in both public and private sector. And so that's where we've been gathering information over the past few months from critical GovGuam agencies, as well as our key partners in the private and non-government sector, who offer or provide critical services during any type of disaster or public health emergency. And so again, that's where we're going to have to decide as a committee based on the information provided, what's going on in our local community. Things are good right now, but as we start to roll out the vaccine, will there be any change, and are we seeing a surge again or anything? And we have to adjust accordingly to that. Now, who's being affected the most, which essential frontline workers that we need to keep out there working so that they can provide the critical services, utilities, transportation, food distribution. So those are some of the key sectors. And there's about 16 within a community. And we get that guidance through from FEMA. There is something called the cybersecurity, that CISA, that they are the ones who put out who are the 16 critical infrastructure sectors in a community. Some we don't have on Guam, like nuclear facilities. So again, we focus on what we do have on Guam, and we will tweak it to match our population. And again, following national recommendations, just refining it. Then 1C is when we move to adults with high risk conditions, medical conditions that put them at disproportion to having severe COVID illness, and then also our Manumco 65 and older. So that's phase 1. That's broken down into 3 steps. Then in phase 2, we try to finish up immunizing anyone in phase 1 that didn't get it. And then we start to expand it out to more of the critical infrastructure personnel, and then the general population. And then we will continue the same thing in phase 3.
So phase 2 that's where you're talking about probably summer.
No, we as soon as we get our vaccines, we go through phase 1A, 1B, 1C.
Mm-hmm.
And if we have any vaccines left, then we will pull up anyone for phase 2. And again, as we're rolling out the ultra cold vaccine, the Pfizer, we will start to also have the ability, if Moderna's vaccine is approved, then those vaccines are also distributed out to the jurisdictions. And so that as we start to receive more vaccines, then we start expanding who we can immunize. But it will take us until maybe the summer is what is anticipated to have enough of our community immunized. And again, it's all dictated on how much vaccine is available and released to the various jurisdictions. Because even at the national level, CDC has to also disperse it across 64 jurisdictions. And so it's based on our population as well.
Yeah, under the residents of long-term care facilities, is Gumatran-Kiladot part of that?
They can be considered, yes. So anyone like assisted living, the skilled nursing unit,
Right.
and Dominic.
Okay.
Yes.
Under essential service workers, clergy part of that, or no?
They can be considered, and our government has put them up there just because of how vital they play a role in our community. And again, that is something that within the VA PPC, we would have to further refine, because limited doses, and we have to be equitable about spreading it out across the various critical infrastructure sectors.
Food commodities, you mentioned that, and we did have the Mayor's Council president on yesterday, and we did ask her about the vaccines and whether or not they would be included in this initial rollout. And Mayor Savara says, yes, they are frontliners, but they're just not in the right line, right, for the vaccine. Will they be part of phase 1 or considered essential workers?
Yes, they are. They were requested their information, which they responded back to us so that we can have an idea of who within the respective municipalities are considered tier 1, tier 2, tier 3. And again, every mayor is different. Their staffing pattern is different. So we've received that information. And again, this is the information that we collect and we will present to the VA PPC as a whole, because again, we already know we will not have enough vaccines for everyone who's considered a tier 1, be it GovGuam or the private sector. And so now the decision will have to be made. How do we equitably distribute it out that we don't favor just one area over another? Because again, we have to ensure all essential functions of society are still operating. So yes, food distribution is critical, especially for our vulnerable. And so transportation, utilities are just as important. So how are we going to spread that out? Even though, you may have X number in your organization that you say are tier 1, we unfortunately cannot provide everyone in that tier 1 because we have so many other organizations who also have tier 1. And so that's the decision where how many within each of these critical sectors can we provide the vaccine, asking them for their patients for the remaining group while we get more vaccines in. So that's something that, again, to be fair, to also be able to give it out to individuals who can't come to us. And that's a key thing too, is we're not just looking at GovGuam and private sector partners, it's the residents as a whole. So there are things where we've discussed closed pods. They're going to come to us, like the healthcare providers, that we will immunize them. Our GFD frontliners, they'll come to public health to immunize. But then there's individuals who don't have the transportation. Now we have to go out and offer it into the community. So those high-risk individuals will have the opportunity as well to get limited doses of vaccines available to them.
Right. I mean, yeah, you could kind of see like the line for the essential frontline workers, the ones that have been working since the start of the pandemic.
Right.
Like you said, the police officers, the firefighters, the mayors. So yeah, that makes sense.
Art, what kind of challenges does having to roll out and execute this vaccine planning present when you've also got a big part of the department still responding to the COVID-19 pandemic?
In terms of messaging, I'm sorry, Chris, your question is what is our messaging for the vaccine?
No, I meant how, is it a challenge to, you anticipate it being a challenge to roll out the implementation and execution of this vaccine plan while you also have a big chunk of the department's personnel still responding to the COVID-19 pandemic?
You know, Chris, what the plan is that we will reposition our staff. As you know, we are doing community testing starting today.
Right.
We did it last week. So when the vaccine comes, we will need to make a shift in how we approach the administration of the vaccine. So we're going to reposition the staff. Our incident command system will shift so that we ensure full support for the arrival, storage, distribution, and administration of the vaccine. So we will continue, though, maintaining testing at our Northern Health Center. That activity will continue, but we will definitely take some of the staff that are currently out there doing community testing and reposition them to the pods. And so when we first started, the pods are only going to be 4 because of the limited number of vaccines, and that's Guam Memorial Hospital, Guam Regional Medical City, our Northern Health Center, and in Manila at Castle Mall. So those are going to be the 4 key points for the first arrival of the vaccines. And as Annette has indicated also, in addition to the Castle Mall, there'll be some of our high-risk groups that are home-based, and they will then reach out to them. So yes, we've been talking about how we would do this and that we would need to reposition our resources to assist in the planning, deployment, and administration of the vaccine. So it will be a challenge, but it will be one that we require for us to reposition our resources.
Are how many cold storage units? I forgot in the video. Is it 2 or 3?
Well, the way what we have right now, Sabrina, is within government agencies, we actually have 3 freezers. 2 are in the same location, and then 1 is at an alternate location. The 2 freezers that are in the same area is going to be our primary storage area, and then the alternate site is going to, which is our 3rd freezer, is already in place. And both sites are going to be having security 24/7, and both sites also have a backup generator. So we want to be sure that if there's any power interruption, we don't lose the vaccines due to unable to maintain temperature. And then also that just for the safety of the vaccines, that it is going to have security 24/7. So we have 3. Also want to share with you, I'm sorry. Yeah, we also have reached out, Admiral Manoni has reached out to the governor, and the governor's reached out to Admiral Manoni. And in the event our government systems need further support, the Admiral has offered the Naval Hospital as an alternate potential site. So, you know, we hope we don't need to go there, of course, in our planning efforts, but in the event that we do, we will definitely reach out to our military partner.
Yeah. I was wanting to ask if we were gonna get any more cold storage units, because we just heard from the governor of the CNMI, and he announced during that Rotary Club meeting that they actually got 10 cold storage units over there.
Can borrow?
Oh, I don't know if they're gonna let us borrow, but I don't know about that, Chris. But we didn't order storage point units initially because we actually have them on island, and that was something that we just needed to share with the community, and so that's one of the reasons we sent that message out. But Annette, maybe she can also update us in terms of, because she is overseeing the program directly, if we have plans. I think there is a plan to acquire another one, but Annette can confirm that this morning.
Yes, thank you, Director. Yes, we are looking at acquiring at least 2 more ultra cold freezers, just as a backup to the backups that we already have, even though what we currently have on island is more than adequate for the ultra cold vaccines, because again, these are 2 milliliter vials that are 5 doses each. So it doesn't take much space. Okay. So the smallest unit that is available for us than the ultra cold, which is considered an under counter, is more than enough for the shipment that we will be receiving. But as the director said, he's ensured that we have redundancy. And so we have 2 larger freezers that are also available. So we have already more than enough capacity on Guam, with the ultra cold. And so, but just as a precaution, again, we are looking at procuring at least 2 more units that are larger units. But that's just specific to the vaccine A, Pfizer vaccine. For the Moderna vaccine, you would not be able to store those in the ultra cold. It's too cold. So they would be on what's considered like -20 freezers, which the immunization program has the capacity already. And then even our partners who are enrolling with us, again, this vaccine can go from the freezer into the refrigerator and be stored at a longer period of time than the vaccine A, which is very sensitive. So again, we've also been enrolling our private partners. So as the department is really focusing on the high risk and putting it out to the general community, we have more than 20 private partners in the healthcare sector that have signed up, and they're going to help us by immunizing their population, their patients in their facilities, while public health is doing like what's considered the mass vaccination. So again, it's a community-wide effort. Public health is not doing this alone. And so again, those are the things that we have been preparing over the past few months to give our people as much opportunity to receive the vaccine in different locations, be it the private side or the ones hosted by public health.
If I just may add really quick to what Annette said, you know, we talked about how this is very much evolving, it's very fluid. So at one point we were advised that we would be doing a weekly order. So we did place our first order on December 4th for 3,900. More recently, we are receiving calls or email messages and other forms of media. And basically now what we're been advised is our orders are going to be delivered monthly as opposed to us making weekly orders. So as Annette said, for Pfizer, we have 11,700, for Moderna, we have 7,600 that has been identified for Guam's allocation, apportionment of the vaccine. And so again, that's half again because it's 2 doses, so it's 3,800. And so we're looking at total of both vaccines with total basically ability to vaccinate 9,650 individuals, both Pfizer and Moderna. And that's our December order. And so we've been advised as recent as yesterday that our shipments will be coming in monthly, and it should be here the first week of each month. Again, this could change, as Annette said, it really depends on the situation, the supplier, and what CDC provides to us. So initially it was like a weekly order, and we positioned ourselves, we submitted the first order, and now it's a monthly order, and we received confirmation that the numbers that we have is what we have at this time. And this is just as of yesterday. And we may get a call today, later today or next week that changes this information, and we'll definitely press that out so the community stays informed if any changes occur in terms of quantity of ordering. And so I just wanted to share that with all of us here today and those listening in on the discussion.
What about the National Guard? Are they part of this, the vaccination plan on public health side, or do they get their own doses of vaccine from the military?
It's a combination of both. They were informed that they are getting a certain amount, but again, it's not enough for everyone, and that's for those in uniform. So they do have their civilian staff, and so that is something, again, we've reached out to them as well for the information request on prioritization within their workforce. And so yes, it'll be a combination of what they receive through the DoD, and then what the health department will provide to them as well.
Okay, so National Guard partially covered under the Department of Defense.
Right. Okay. And that would probably be for the active personnel, right? Right.
Okay.
Yes, and we've received clarification, like for the VA, that they actually will be coming through our allocations for the veterans. And so again, that's something that just was clarified over the past couple of days, right? Because even on the DoD side, the federal level, they have who are they covering, and that also has been, evolving over the past few months as we prepare for the vaccine allocations to be distributed.
So is it possible?
So it is a multi-pronged.
Is it possible that you guys would be giving out the vaccine at the Cboc clinic then?
Yes, that is our intent, is to get them enrolled. And again, providers are required to fill out a CDC form in order to avail of the vaccine, to receive it and distribute it and administer it to their patients. But there are also local requirements in regards to storage and handling and the reporting of the vaccine administration to us, because all of this information, the immunization program here, the department would have to compile and report up to CDC of how much vaccines are available, still on hand in our inventory at as a whole, and then how much vaccines have we used on a day-to-day basis. And so the partners that are enrolling must report this information to public health so that we can compile it, summarize it, and send it up to CDC as required.
Okay. Is there anything else that we should be
Bree has
asking
like
you?
a 4-inch printout over here that she came prepared, but
No.
is there anything that we might have missed that the public needs to know?
Well, I think if anything, it's probably people might be curious. The packaging, there's 975 vials, and it's in a package that's 9 by 9 by 2. So that's a dimension. So that's why when Annette was saying we have adequate capacity for storage, is because they're not large boxes to store. But we're pretty much positioning ourselves for its eventual arrival, and continually reviewing to make sure that we're positioned, working with our team to advise them that once the vaccines are here, we're going to have to reposition our resources so that it's not just this last minute approach, but they've already been informed, so they're ready to reposition as they need to.
Right.
And I want to say public health team and all our partners are really working well together at this point, and not that we were never working well together, so please don't take that out of context. But you guys are quick, I know. So they're working really, they're very dedicated and diligent in what they're doing today with the community testing, but they're also just as prepared to roll out the vaccine administration. So that's where we're at this time.
Real quick before you go, Annette, I know you had mentioned in our other interview this week about security, right? So how's that going to work? Are we talking like major security to protect the location of the vaccine?
We would have individual present just to ensure for security purposes to, throughout the night and day, just so that there's no concerns about it. Again, it's very limited doses, so it's very precious to us, and we want to just make sure and not just physically being there, but also, God forbid, if there's power outages or something, that they would also be able to warn us that, hey, there's something happened with the power. And again, these vaccines are very sensitive to the heat, and so that's why it's ultra cold. And so we just need to make sure, as the director mentioned, the backup generators are also there. So it's not just having only security, but we have to make sure the generator is there to ensure that the power is uninterrupted.
All right. Thank you guys. And Art, Annette, I know that you guys are going to be rolling out the public education campaign. Please count us in. You need help, let us know.
Yep.
Yes,
Jay had some ideas too, yeah. So definitely, bend our ear and we'll get it out there.
Will.
Okay. Thank you, Art.
No, thank you.
Thank you for coming on. Annette, always good to see you. Have a great weekend. We have virtual yogurt-covered pretzels. It's Jason's day to bring. Don't ask. I don't know. But it's from Trader Joe's. So take some on your way out, Art. Okay?
Thank you.
Thank you.
All right.
Okay.
Take care.
Okay.
Thank you. Thanks, Sabrina.
All right. To our viewers on KUAM TV, there's a whole bunch of great programming coming up. But if you want to catch up with us on the link of the breeze, we have Dr. Peter Lombard coming up. We're going to go to the NMI with Kevin Bautista. We got our GMH update with Lillian Posadas. We'll also talk with Janela Carrera, the spokesperson for public health, as they're getting ready to roll out community mass testing this morning. And former Governor Carl Gutierrez, I think he's coming on, but definitely Jerry Perez, the GVB deputy, is for sure coming on. And we'll also do curbside. There's a lot. So Chris, miss a link, miss a lot. So don't miss it, okay?
Yeah.
KUAM TV, my name's Chris.
I'm Sabrina.
Esta Ellos! Ho, ho, ho! All right, we're back with Dr. Peter Lombard crunching COVID stats.